So our patient is a keen sportswoman in her early 20s. She's recently increased the intensity and the regularity of her sport, and she's found that the intermittent pain in the lateral ankle has now become constant and severe. She's got a tibial verum and a high arch foot structure with a substantial forefoot equinus. The joint range of motion tests show that the midfoot joint complex is restricted in its range of motion, and there is an adaptation of a forefoot supinatus. Muscle tests show overall good function. However, core strength could be better, and the perineal group is weak and becomes painful with resistance testing. So we go through a process looking at history, as we all do, and we palpate the symptomatic area, and if possible, try and elicit the symptoms to understand what exact tissues are being overloaded and any possible compensations the body is using to offload the injured area. Then I use functional tests to see how the musculoskeletal systems are interacting in function. Now, there's good evidence-based weight-bearing and non-weight-bearing assessments we can use to help us develop a hypothesis of why the patient's concern is present. But at this stage, it's only a hypothesis, and we'll need to see the patient functioning in weight-bearing activity to see if we can work out if our hypothesis is right, and that's the cause of the problem. So she is having this problem when she's running, so we must see her run. So treadmills with plantar pressure plates can provide this information quickly and accurately, so long as a patient's gait is normal and of a similar intensity when the symptoms are felt. So when you ask your patients to run on the treadmill, you'll have to ask them, is this how it feels when you're running? Now, if they're running outside, they'll have the resistance of the wind against them. And so consequently, you might have to increase the speed so they can actually have the similar amount of intensity. It may also take some time to get the patient comfortable on the treadmill and have them running at a higher speed. But anyway, once we've got them running, we can see with the plantar pressure analysis and that the initial contact is under the lateral column of the foot with significant loading under the fourth and fifth metatarsals that remains there for most of the stance period. We can see that because of the forefoot supinatus, it's limiting the medial column loading. So that what medial column loading there is mostly through the IPJ of the hallux. There's hardly any movement of the center of pressure, the white line, because of the stiffness through the midfoot. So we can very quickly understand that the tissues are loaded and it fits in with our hypothesis. This is the difference with just looking at tissues being overloaded and saying, yes, there's high pressure there, and trying to understand why and get an understanding of what's causing the weight-bearing pattern so we can develop some sort of treatment strategy. So in this situation, what we could do is we could add some taping or wedging and then reassess and compare. We could use some J taping to improve the proprioception, stabilize the calcaneocuboid joint, and facilitate the perineals that were somewhat being inhibited. Or we could use some functional taping to improve the autosupportive mechanisms of the foot. Or we could use wedging, or we could do some mobilization of the midfoot and do it with shoes and without shoes. All of these times once we'd applied an intervention, we would then reassess the patient running on the treadmill. And yes, with shoes, we would not be able to see the pressure mapping so well because the shoes would hide that to some degree or influence it perhaps. But we could see where the center of pressure was going, and we could see as a visual thing using video if the foot was being so inverted. So the key thing here is to do an examination, form a hypothesis, check if reality meets the hypothesis, and then use an intervention and compare to see if the hypothesis is correct and devise a treatment strategy to address the problem.